what would your advice be to medical students who are maybe like in their third year, they're running through the core clerkships? Obviously, psychiatry is one that everybody does. What would you say if they're kind of interested in psychiatry or considering it? What would be your advice for them to kind of help them decide that? Because in a way, like you've mentioned, psychiatry is in a lot of ways very different than many other fields in medicine. Obviously, you're still a physician and you use your medical training, but there's some aspects of it that are very different. I guess what would your advice be for those particular students?
It can be considered a little more of an art sometimes than a science, because sometimes where I would say we don't have as good a scientific understanding of the major mental illnesses that we do of a lot of medical illnesses. And there's lots of reasons for that. I think if you're able to, and this always comes with a downside. I know we have moved to having our medical students just have a 4-week psychiatry rotation in the third year, and they do 2 weeks on the inpatient unit and then 2 weeks on consults. I don't love it because I don't know that they get to stay around long enough to really see people get better and progress through the treatment. So that's the downside to it. The upside to it is that they get to see people doing very different things. So I would say if you have the opportunity to see different areas, so you might really love inpatient or you might really hate it, but you might love outpatient. So because they're so different, the patient populations are so different, you're going to have a much longer term relationship with an outpatient than you are with an inpatient. And it's so different that I would say if you could see it in a couple of different settings, that would make a difference. Even different hospitals, right? Even, one inpatient unit is not the same as another. There's even a lot of variability there.
Gotcha. And then I realize we could do a whole episode on this, but I guess what's your general advice for people applying? They've made that decision to go into psychiatry and they're applying to residency and maybe doing, like you said, the one student rotating with you is doing like an internship. What are kind of some things on like the best ways to present themselves and, demonstrate their passion for the field?
I do, I think it's interesting to me because back when I applied, it was an easy residency to get. It's getting more competitive, which is a wonderful thing. I just feel like we need a lot of psychiatrists, so they should increase the number of positions available. If you're interested, I think the acting internship is a nice way for us to get to know you. So I do think that those, if you have a place that that's where you really want to go, I think that doing an acting internship is a very good idea. If you can do, even if it's not huge, but like a poster presentation at a conference, I do think that if there's some research on your CV, that also appears to be helpful. Other advice, those are probably the two things that I think that I would look at, and just to sort of develop relationships with people so you can have more experience in areas that you might really like to see more of. That wasn't very articulate, but I think that, developing some relationships with people who are in the field who can sort of steer you in the right direction is a good idea as well.
Sure. And then you mentioned research, and then I guess is psychiatry also a field where maybe some students who have like an interest in, maybe they didn't go as far to do an MD JD per se, but like maybe students who have an interest in the legal system and the law and things like that, do you think that could fit well with someone who has those types of interests as well?
Sure, especially if you're interested in forensic psychiatry. So we do have one of our new fellows that's upcoming, that's coming from our program. She's actually a MD-JD, and that's a good, that's obviously a natural fit because she has all of that experience already in the legal system, which the rest of us have to get to know and understand a little bit. So, if you're interested in forensics, that's sort of a natural fit. Otherwise, just to be a general psychiatrist, I don't know that it's all that helpful.